What mattered more was that we were providing them the opportunity to bring meaning to their lives, and that's made all the difference. I also believe that I had to prove myself time and time again to my colleagues or to those who I served and led in various roles. We know that philanthropy is one of the three most sustainable ways to be able to fund healthcare. The first being reimbursements, of course, second being federal programs and federal reimbursements. As we entered that unit, a little girl came out of our dining room and she was just grinning from ear to ear. Well, she went on to tell me and to tell that benefactor family that it was her 10th birthday and how special the staff at our facility made that day for her. But thanks to benefactor support, and I want to make sure that I underscore the incredible generosity that we're privileged to receive every single day from more than 19,000 individual donors last fiscal year.
Welcome to the Digital Health Transformers podcast series. In this podcast, we explore the dynamic world of healthcare innovation, one conversation at a time. I'm your host, Nicole, and today we have an inspiring guest at the forefront of transforming the healthcare landscape. We are excited to welcome our guest of today's episode, Dzenan Berberovic. Janan, the Chief Philanthropy Officer of Avere Health. Janan's story is one of resilience and dedication to service. Born in Bosnia, he fled to Germany with his mother at a young age to escape war. After settling in South Dakota, Janan embraced education as a means to a brighter future, becoming the first in the family to attend college. As a first-generation college graduate from the University of South Dakota, Janan's passion for service led him to a career in the nonprofit sector. He champions philanthropy, leading Avera's health efforts to make a difference in the community. Beyond his role, Janan also remains deeply involved from the Banquet to Phi Kappa Alpha Foundation and is dedicated to giving back. Recognized for his impact, he serves as the advisory board of the College of Arts and Sciences at USD, establishing scholarships for future generations. His story showcases the power of education and community support, inspiring others to create positive change. Join us in this discussion with Janan as we delve into his journey and explore the role of digital health in expanding philanthropic reach. Thank you for joining us today, Janan.
Good morning, Nicole. Thank you for having me.
Wonderful. It's great to have you today here in our podcast. Janan, you've remarkably transitioned from a first-generation college graduate to a chief philanthropy officer. What inspired this shift from student to leading a philanthropic efforts of Avera Health?
That's a wonderful question, Nicole. And as I ponder that, I think about all the experiences that I was gifted in my life, from the opportunity to escape a war and live in a very safe place in Germany for about 6 years at an organization in a refugee camp that was run by an order of nuns, to coming to the United States and then receiving a full tuition scholarship to go to college. All of those experiences, I think, inspired what became my life's work in philanthropy. But as a college student, I had the opportunity to host constituents to the university, to work in a call center at the University of South Dakota Foundation, and then, of course, to feel the transformational impact that philanthropy can have on really changing somebody's life. So that's what got me to the place where I'm at today. I worked in higher education philanthropy for several years ahead of joining Avera in 2017. So I have been at this organization now for several years, and every single day I see the impact of philanthropic support unfold around me.
Wonderful. That's so exciting to be able to apply your knowledge and your experience from college and then from just with the university to a full bigger healthcare system like Avera Health. What were the key challenges that you faced while navigating from being a college student to a prominent leader in a nonprofit sector?
Yeah, I would say, Nicole, that those challenges or maybe even opportunities were incremental. Of course, first it was getting a role in philanthropy, landing that first job, because as a 20, 21-year-old Janan, I at that point, all I wanted to do was be a major gift officer someday. Little did I know where that path would lead me, and little did I know that it would lead me back to an organization that is co-founded and served by two orders of vowed religious women, the Benedictine and the Presentation Sisters. So when I come to work every single day, this is very personal to me, because those sisters that cared for me during the most vulnerable time in my life, in a way, they are still with me through a couple different orders. But you asked about some of those early challenges that I maybe faced in my career. That first one was really getting the job in philanthropy, then proving myself. When I first started in this work, I was doing more leadership annual giving work, which would be $1,000 and $500 gifts that constituents were committing to or providing to the organization at that point. And as I became comfortable with that and became more comfortable in engaging and building relationships, I then started to do more work in major gift level work. And soon enough, that led to leadership level work and then principal level or transformational gift opportunities. I think every single one of those um, roles or responsibilities meant that I had to stretch myself. And you don't grow until you lose sight of shore. And so I think many times of the first time I sat in a living room in someone's home and invited a family or a couple to provide a seven-figure gift. That was very scary for 23-year-old Janan at that time. But what I learned was that you can achieve anything through building meaningful relationships and by engaging people in a way that brings meaning and significance to their lives. And so it far less mattered how old I was. What mattered more was that we were providing them the opportunity to bring meaning to their lives, and that's made all the difference. I also believe that I had to prove myself time and time again to my colleagues or to those who I served and led in various roles, because sometimes I was younger than those who I was serving or leading at that organization. And so when they saw that I was willing to roll up my sleeves and do the same work that I was asking them to do, or the same work that we were being asked to do, that made all the difference in this work.
That's great to hear. It's somehow your impact has a profound, I'm guessing your experience has a profound impact on your current situation right now with Avera Health. And just learning the ropes of philanthropy as well as gift giving is such a, I think, a challenging avenue for a lot of people. And you have done such a wonderful job. I commend you for that. My next question is about roles in philanthropy and shaping today's healthcare landscape. How do you see philanthropy shaping the future of patient care and access to services?
What a wonderful question, because so much of our time in recent years in healthcare has been focused on social determinants of health, or how do we make healthcare more affordable for those who turn to Avera at any of our nearly 40 hospitals or more than 40 senior living communities? How do we make it affordable for them, and how can we make sure that we provide care that's above and beyond? Here at Avera, as we look at philanthropy, we recognize a couple pieces. We know that philanthropy is one of the three most sustainable ways to be able to fund healthcare. The first being reimbursements, of course, second being federal programs and federal reimbursements, and third is that philanthropic piece. We know that the only way for us to be able to impact our patients, our residents, and their loved ones is by making sure that the healthcare experience is above and beyond what they may be imagined. And that's where philanthropy really comes in. Private support through donations and through philanthropic giving, ensures that we allow philanthropic support to be budget enhancing rather than budget alleviating. And so as we look at capital projects, some of the most significant facilities and capital initiatives that Avera embarks on, philanthropy has the opportunity to be a centerpiece of that. But also when we look at some of those programmatic pieces, like being able to provide somebody a place to lodge at while they or their loved one is receiving care. We have so many individuals after a solid organ transplant or individuals who are receiving life-saving care either in our ICU, our pediatric ICU, our neonatal ICU. They or their loved one need a place to stay because the last thing on their mind is where they're going to sleep when they follow a helicopter to one of our tertiary care centers or follow an ambulance to get to that location. And so when we can come alongside those patients and be able to provide lodging, a meal voucher, maybe it's even a free wig for that cancer patient, that makes all the difference in being able to provide that care. And then some of our more programmatic pieces. There are programs at our organization that are nearly 100% funded through philanthropic support. One of those being our navigation center for cancer patients, but also those who are walking those cancer journeys alongside their loved ones. So philanthropic support makes all the difference. And what a blessing it is for us in healthcare, regardless of what health system or hospital one serves in, we all get a front row seat of seeing how philanthropy unfolds all around us. Sometimes it's through equipment, sometimes it's by being able to provide an employee who's facing a financial hardship that employee assistance support so that we can make sure that they and their families are cared for during really trying times for them personally.
That is such an amazing structure for Avere Health and going hand in hand with philanthropy. I love what you said about reimbursements, that there are insurance reimbursement, federal reimbursement, and philanthropy as the arms of how Avere Health structures itself. And it's amazing to hear the stories that you just provided regarding how philanthropy has impacted healthcare, especially in patients' lives and their families. Like you said, it's kind of sad to hear that some families still have to worry about their finances or where they're going to be staying for the night when they have a sick family member. But with Avera Health, somehow they have found a full circle way of helping their patient, not just healthcare wise, but holistically through the finances as well. So that's very commendable for Avera Health and for you in your position to help Avera Health accomplish those services. My next question is, can you share any examples of how philanthropic initiatives are impacting healthcare outcomes and patient experiences?
I can. I don't think we would have enough time for me to sit here and be able to share those experiences with you, Nicole. There are incredible, as you asked that question, I think about the dozens of stories that come through my mind and touch my heart of how we're really helping with providing favorable outcomes. A couple of those examples would include in the last 2 years, we did a comprehensive campaign to be able to add a new wing to our behavioral health facility. The Helmsley Behavioral Health Center, which is what the new wing is called, is a beacon of hope for adults, for at-risk children, for at-risk youth, as well as for senior citizens who are really facing behavioral health challenges that many of us would never even think of. At our facility, we treat children as young as 3 years old who come to us and are provided with a inpatient behavioral health stay. I think about in 2022, I provided a tour for an incredible benefactor family of our behavioral health facility. And during that tour, one of the areas that we visited was our child unit. As we entered that unit, a little girl came out of our dining room, and she was just grinning from ear to ear. Well, she went on to tell me and to tell that benefactor family that it was her 10th birthday and how special the staff at our facility made that day for her. So I took a step back and I recognized where we were at that point in time. We were in a psychiatric inpatient facility, and we were looking in the eyes of a 10-year-old little girl who was telling us how special the staff made her day. And on her 10th birthday, unfortunately, she was in a psychiatric hospital. So I think about the journey that she was on that day, and hopefully the more positive days that she was going to experience thereafter. I also think about our NICU babies, who many come from our most rural facilities in the plains of the United States, and they take their first air flight in one of our helicopters or fixed wings to come to our facility. We're now caring for newborns as young as 22 weeks gestation. 22 weeks. So that means that that child weighs less than a coffee or a soda when they are delivered, and they come to our facility, and many of them go on to lead amazing lives. That's, of course, after spending 35, 36 weeks in some cases in our facility. I also think about our ICU or our pediatric intensive care patients, and how our teams are so privileged to be able to provide care to them and to their loved ones during that most probably critical time in their lives. And we do it through a holistic approach. We do it by caring for body, mind, and spirit. And then, of course, as a Catholic health organization, we have a deep commitment to caring for the poor, the vulnerable, and the marginalized every single day. And that's been our mission for 125 years.
That is so admirable. And I think a few other hospitals, even in third world countries. I did my medical training in the Philippines, and some of the government nonprofit hospitals there need what your Avera is doing, having that philanthropic arm in its structure. And it's so amazing that you shared those stories of the 10-year-old girl who had her birthday. It's very holistic, it's very humanizing healthcare, basically, not just being in a hospital for your 10th birthday, but the staff creating it as a memory for that little girl. So it's wonderful. Your impact is so profound right now with Avera Health, and that's amazing. Um, my next topic is about the influence of philanthropy on strategic planning in healthcare. How does philanthropy impact the strategic decisions made by the healthcare organizations, particularly in planning for future initiatives and programs?
Nicole, that is an amazing question. And right now we are wrapping up our budget for the next fiscal year, which also means that we start to make revisions or nuances to Avera's capital outlay. We lead and serve in philanthropy from a place of being able to come alongside all of those initiatives. So when we look at Avera's next 5-year capital outlay, which is more than $750 million, philanthropic support is key to that. So just this morning, we had our capital management council meeting for the system, which means that as a result of regional and other work stream areas that have met over the past several months, we then come to a place of saying, okay, here's our capital projects for the next fiscal year. All while those individual conversations are taking place, the foundation team is supporting those efforts. So as we look at Avera's next capital management opportunities, we then are able to say X amount will be funded through a minimum of philanthropic support. And so we start to build in minimums for each of those projects so that we can then say, okay, because philanthropic support was able to support all of these initiatives, we now have additional dollars that can support projects that maybe would have not been able to move up on that list, but thanks to benefactor support. And I want to make sure that I underscore the incredible generosity that we're privileged to receive every single day from more than 19,000 individual donors last fiscal year. Those generous individuals help us to then be able to fund many of the projects, and they would have never been possible without their generosity. So
19,000. Go ahead.
yeah, so that philanthropic support is really the difference maker because of our donors on any given day with truly any project that we embark on, whether it's the construction of a new women's and children's hospital, the addition or the expansion of behavioral health services in one of our other regions, the addition of patient and family lodging on one of our campuses. All of that is made possible through philanthropic support because of our generous supporters.
Wow, 19,000 donors. I can't imagine even just 2 to 3,000 donors, but 19,000 donors. That's a lot of generous people who are willing to donate their time and money for a wonderful organization and just to make a huge impact in lives of thousands or not millions of patients. That's such a great story. In what ways can philanthropic partners and funding influence the development and implementation of strategic plans within healthcare institutions?
Sure. So at Avera, our philanthropic work is really guided by a philanthropy plan, which works hand in hand with the strategic direction of our organization. So rather than the foundation and philanthropy doing its own work on any given day, we know that truly the sole reason why our foundation exists or any of our departments within the foundation exist is to ensure that the strategic plan of our organization comes to life. And so not only are there key measures in our present strategic plan that are related to philanthropic support, but as we look ahead, and right now we are undergoing a process of crafting our next strategic plan for the organization, philanthropic support is pivotal to that. So as we look at the expansion of services, our desire to serve even more patients than we already do, because many of our largest communities are welcoming more and more new citizens or new residents to those communities. We want to make sure that we support that growth.
It's always great to have a goal in mind before you put in some money into a project. So before the budget, it's important to have like a holistic mission, vision, goals, objectives, and whatnot to give yourself a roadmap for the future. And I believe your strategic plan does perfectly do that for the organization. And it's wonderful to hear that your strategic plan does not only impact the whole patient population in general, but also the community as well. It brings a cohesive community together of not just the patients, but also of donors who want to see their money being used the right way. So it's wonderful to hear of your story and as well as your story and your work with Avere Health. My next question is, how is philanthropy utilizing technology to streamline processes and enhance efficiency in the daily operations? Or how are philanthropic organizations addressing the challenges of data security and privacy in the digital age, particularly when it comes to implementing technology-driven solutions?
Now we're getting serious, Nicole, with this question. A couple ways. So in 2020, when we unified all of Avera's foundations, we had a goal, and that was to build a best-in-class operation from a philanthropic operations standpoint. Not only did we want to make sure that our North Star remained that we would provide every constituent a gratifying giving experience, but we wanted to make sure that the operations of the foundation mirrored that as well. And so there are a lot of pieces that we've been able to automate in our work, everything from our daily technology of screening grateful engagement and patience to support our organization, to even the work that takes place through clearly defined standard operating procedures. One of the things that you asked about was how are we utilizing or looking at data security? Well, that's really being done through clear standard operating procedures and then a commitment to everyone on our team embracing that work. We've also gone as far as developing different security groups in our core system, in our constituent management platform. So based on the level of work and what somebody's core responsibilities are on our team, they have certain security features that are unlocked to them as it relates to our core system. And so those are just a couple different pieces that we've put into place to make sure that data integrity, that data security are all part of our work. And then we've also been able to promote someone on our team to really be that lead database administrator for our entire organization. And so as we've gone through looking at all of our constituent records of doing a full, what we call database hygiene process of our data related to our constituents, we were able to promote someone into that role to really oversee the database and serve as our champion. And so there's a couple different work streams that are working hand in hand in the foundation to make sure that some of those data sets that we have on our constituents are clear, that we have some rules and that we have some principles as well as standard operating procedures that govern our database as well as our other platforms that we use in the foundation.
That is great to hear. You are absolutely the best in class with the Avera Health and philanthropic initiatives. It's great to hear that you're using automation for patient choices, or even through your automating of donation processes and workflows. And having that security behind those donations is important, especially if you have 19,000 donors. It's somehow feel like the excellence of donating and philanthropic arm of Avere Health has gone so well with your leadership, and I commend you for doing an outstanding job with Avere Health as its philanthropic chief officer. So let me give you this chance to do a shout out to promote whatever you're currently working on, any projects that you want to include as we close out this segment of our podcast. The floor is for you to speak out on whatever project you're currently working on.
Sure. Well, thank you, Nicole, first and foremost, for the invitation to have this conversation with you today. I have enjoyed the opportunity to share a little bit about who we are at Avera and some of the things that set our organization apart. I know that you have listeners all over. What I would encourage them all to do is to consider healthcare or their local hospital as a place to donate. If you think about it, health systems and hospitals are the only place in society that serve everybody. Higher education serves a specific population. Local unhoused shelters serve a specific population, but hospitals serve every single person. In one room, you can have an individual who maybe is unhoused receiving care, and in the room next door to them, literally with just a wall and two doorways dividing them, you can have someone who may have their name on a local hospital, and both of those individuals are receiving exceptional life-saving care. Philanthropic support is vital to health systems. it doesn't matter if you are a small critical access facility or if you are a regional medical center that serves hundreds of thousands of individuals during any given year. Hospitals are so key to all of our organizations and all of our communities being able to thrive and to serve. And so I invite all of you to look at your local hospitals to see what campaigns, what initiatives they are embarking on, and to hopefully find it in your hearts to support those incredible institutions that do so much good beyond the hospital walls. A lot of healthcare takes place in community, in people's homes, and those organizations rely on philanthropic support to be able to do that. So today, it's far more important for me to just invite your incredible listeners to support their local hospitals than it is for them to support the work that we're doing at Avera.
That is actually well said. Thank you. Yes, you are correct. Healthcare is helping everybody, and some of it is life-changing, life-saving services. So, yes, that's great to expand that call for action to donate to local hospitals or a healthcare system within their reach. Thank you, Janan, for such an invaluable insight into the role of digital marketing and expanding philanthropic reach in this podcast. Your work and your dedication is truly inspiring, and we look forward to witnessing the continued positive impact of digital health technology under your leadership. And I just wanted to close out that this podcast was brought to you by OSP, a leading healthcare software and product development and solutions enhancing company. They develop solutions for revenue cycle management, practice management, billing, coding, advanced telehealth. And for more information, go to our website. And I just want to say thank you so much, Janan. This is an amazing podcast. Thank you for sharing your experience and your workflows and just your overall work with Avera Health. I wish you a wonderful day and thank you so much.
Thank you, Nicole.